Good afternoon, everyone. Myself, Dr. Hema, first year postgraduate, presenting a prospective study of dry eye after manual small incision cataract surgery. Financial disclosure, no conflict of interest. Introduction. Cataract is an opacity in the lens or its capsule, whether congenital, developmental or acquired, which causes visual impairment, for which manual small incision cataract surgery is most routinely performed. After this surgery, many patients have reported of dry eye and postoperative pain symptoms. In addition, the use of topical eye drops, reduced corneal sensitivity, surgical inflammation due to the large incision created in the eye, and exposure to the light from microscope during the surgery are considered to be responsible for postoperative dysfunction of the tear film. This study analyzes changes in the tear film and production of tears after the cataract surgery. Aim is to establish the incidence of dry eye in patients after the small incision cataract surgery. Materials and methods. This is a cross-sectional prospective study done in the Department of Ophthalmology, Andhra Medical College, Government Regional Eye Hospital, Visakhapatnam from July to September 2023, including 100 patients with cataract attending ophthalmic inpatient services. The informed consent obtained from all the subjects after the nature and possible consequences of the study is explained to them. Inclusion criteria. Patients who are willing to participate from the age group 55 to 80 years and with senile cataract with or without dry eye symptoms. Exclusion criteria: cataract other than senile cataract, patients with other ocular and systemic comorbidities, history of contact lens use, patients with constant use of ocular medication, patients who have had previous ocular surgeries. Methodology: demographic details of all the patients were collected. 100 patients who met inclusion criteria were enlisted for cataract surgery. Every patient was asked about the symptoms related to dry eye, and then they underwent Schimmer's test 1 and tear film breakup time test. After this, patients were subjected to the surgery with a 6 to 7 mm superior straight incision, and then on 1st, 7th and 30th day after the surgery, Schimmer's test 1 and tear film breakup time test was again performed. The dryness of the eyes was then analyzed and graded in accordance with the 2007 dry eye workshop classification. Statistical analysis: Microsoft Excel was done in creating the database and producing graphs, while the data analysis done using SPSS 20 software and expressed in the form of tables and histograms. A p-value less than 0.05 was considered statistically significant. Results: out of 100 samples, 26% had dry eye preoperatively, which increased to 89% postoperatively on first day. Out of these 89 patients, 35 were male and 54 were female. This is a line graph showing Schimmer's test. Preoperatively, 16.78 millimeters was seen. After first day after the surgery, it decreased to 7.03. Then after post-op 1 week, 7.15 mm, and 1 month, 10.45 mm. This is the bar graph showing Schimmer's test value. In our study, more than 10 mm is considered normal, 8 to 10 mm mild, 5 to 7 mm moderate, and less than 5 mm considered severe. Preoperatively, out of 100, 74 were mild, 16 were normal, 16 were mild, 8 were moderate, and 2 were severe. On post-op day 1, 26 were severe and 35 were moderate. On post-op 1 month, it is seen again, it is returning to the normal levels. This is the line graph showing mean tear breakup time. Preoperatively, it was 17.89 seconds. Then on post-operative day 1, it decreased to 7.24 seconds. After 1 week, it is 7.84 seconds. After 1 month, it is again increased to 13.23 seconds. Discussion. In this study, we assess the dryness of eyes after the small incision cataract surgery. Reasons might be damage to the corneal and conjunctival epithelium due to the chronic use of eye drops containing preservative like benzalkonium chloride after the cataract surgery. Ocular surface irregularity following the surgery leads to the faster breakage of the tear film. Decreased mucin production from conjunctiva destabilizes the tear film. Decreased corneal sensation due to the damage to the long ciliary nerve and results in decreased tear secretions. This is the comparison of my study with other studies. Venugopal K et al. Study done in 2012 has sample size of 71, which reported peak incidence on first week, and post-op dryness at first week is seen with nearly 43 patients, and follow-up done on 1/7 and 45 days. Mean age is 62 years. Only in this study, among the 4 studies, only male preponderance is seen. In all other 4 studies, female preponderance is seen. In my study, sample size is 100, preoperative dryness assessed is 26 patients. It reported peak incidence on first day, similar to the Dodia K et al. Study, and post-operative dryness at the first week is 89, and follow-up done on 1/7 and 30 days. Mean age was 66.15 years. We observed that this improvement in dry eye syndrome could have been because of the use of a combination of antibiotic and dexamethasone, carboxymethyl cellulose in patients post-operatively. Limitation is shorter follow-up time may affect incidence in our study. A longer follow-up might have added more insight into the behavior of post-operative dry eyes. Major limitation of this study is comparison between site and size of incision with the degree of dryness was not done. Conclusion, moderate to severe dryness of eyes was seen after small incision cataract surgery with corneoscleral tunnel which stabilizes after 1 month. We recommend the use of preservative-free lubricants, antibiotic and steroid combination. These are my references. Thank you.
So I just have to ask you one question. Why you did on day 1 post-op?
So generally many
Is it easy to do like sermons on day 1 post-op?
no sir.
And other thing is like your studies for 2 months, correct? You have done
3 months.
3 months. You have done. Okay. No, that's the thing. You could have done on month 1, month 2, or month 3. What I believe, because that will have a better result. Like after, because your healing process you want to know, no? Whether it is associated with the cataract surgery that you want to know. So you can expand the study. Your limitation I understood, but it's not logic to do on day 1. Patient will not be cooperative. The incisions will be there, healing will be there, and the patient will have irritation, other thing also. Best, I can understand with phaco, you can do it, but your SICS, the incision, conjunctival, you will be having all those things and all. So you can modify your study, what I mean to say. That's it. Chalo.